Hi there, I'm Amy. I'd like to share a little about autoimmune disease and some treatment options within the scope of East Asian and Chinese medicine practices. So the auto in autoimmune means self. These tissues can be in the nervous system like multiple sclerosis, in the digestive system like inflammatory bowel disease like Crohn's and ulcerative colitis or celiac disease, in the important glands of the body like type 1 diabetes or Hashimoto's thyroiditis and Graves' disease, in the muscle, bone, joints, and connective tissue like rheumatoid arthritis, in the skin like psoriasis and vitiligo, and in the vital organs and blood like lupus and autoimmune hepatitis. In November 2020, the Autoimmune Registry Incorporated published their first comprehensive list of autoimmune diseases, more than 150 of them, and recently long COVID met criteria to be added and studied further as a possible autoimmune condition. So in the US, it may be the third largest category of disease after cardiovascular disease and cancer, and alarmingly, females may make up 80% of autoimmune diseases. So it is considered one of the top 10 causes of death for females up to age 64, and onset often occurs in females between 20 and 40 years old, and may be more likely during major hormonal shifts like puberty, pregnancy, and menopause. Beyond these hormonal influences, there are also scientific ideas about the X chromosome playing a role. Females are born with two X chromosomes, males with an X and a Y, and the X chromosome carries many immune-related genes. Although family history is often linked to autoimmune disease, there was a very large study in which people with autoimmune disease who had a twin, more often than not, their twin did not express autoimmune disease. In recent years, several East Asian medicine practitioners have emerged with much experience to share about autoimmune disease cases via writings, lectures, or other formats. Among these, a few I wanted to mention are Giovanni Maciocia, Heiner Fruhoff, and Mazen Al-Kafaji. I have attended lectures by Fruhoff and by Al-Kafaji, who specializes in chronic inflammatory and autoimmune diseases which manifest in skin conditions such as psoriasis. And as a student, I'm still learning so much and gaining experience with these kinds of conditions. I am treating some patients in clinical internships who do experience autoimmune disease. I do have a personal experience with autoimmune disease with vitiligo, which the immune cells are attacking the melanocytes, which produce the skin pigment. A lot of skin discoloration is seen, and this also is experienced by certain family members who do happen to be female from both sides of both families, and other autoimmune conditions are present in family members as well. Common conventional medications include steroids and other immunodepressants, which depress the immune system's functions overall. This may help some people to manage certain symptoms, but it usually creates unwanted side effects and poses a significant risk to different bodily systems, especially when taken long term, which often ends up being the case with these chronic conditions. Here are some other treatment options that are effective and safe to do on their own or in conjunction with conventional medications. Acupuncture, herbal medicine, moxibustion, and cupping therapy have all been shown to have positive effects on regulating the immune system. We do use the needles. We use very small needles. Acupuncture has extremely regulating qualities for the nervous system, for regulation of the immune system, for anti-inflammation, pain relief. It activates the body's own internal opioid balances. And again, in research related to rheumatoid arthritis, acupuncture has been found in many studies, either alone or combined with other forms of treatment, to be beneficial for clinical symptoms of rheumatoid arthritis without adverse effects, and can improve the functioning and quality of life in these patients. Herbs taken internally often are given in the form of granules, which dissolve into hot water and are drank like a tea, usually twice a day or so, at different dosages depending. And we would modify the herbs and the dosages along the path of changes that are occurring in response to them. This is a really important aspect that we can monitor closely for the best outcomes. Herbal medicine programs in nationally accredited master's and doctoral programs for Chinese medicine are complex, are extensive, and are evidence-informed by both classical historical medical literature and by modern data. Rheumatoid arthritis is one of the most commonly researched autoimmune disorders, and one of the herbal formulas that is commonly researched for it has shown significant decreases in pain and other symptoms and significant increases of quality of life for patients, more so than with conventional therapies alone. Moxa, or moxibustion therapy, is often used in conjunction with acupuncture by the burning of the herb mugwort. And it can be used in different forms. This is a charcoal version of it. There is a loose version that can be rolled up to burn in little cones on top of maybe ginger, or it can be placed on the ends of needles to be able to travel, the heat travels down through the needle itself. Moxa has a lot of healing properties that have been showing in research. With regards to rheumatoid arthritis research, it has shown that in conjunction with conventional therapies, it improved pain levels more than the conventional therapy alone, and had notable improvements in inflammatory biomarkers in the blood serum after 8 weeks of treatment, with beneficial increases in pain-relieving endogenous opioids. Moxa aids circulation of the area treated and can help improve joint swelling and pain. All forms of moxibustion burn at a very high temperature, and the heat really can penetrate the surface to get to deeper layers of tissue. So this is usually done for a matter of 5 to 10 minutes until the area feels thoroughly heated. Cupping therapy is also becoming more recognized. More athletes and celebrities and people in general have been seen with the cup marks, and this is the result of the suction of the cups bringing really older, deader blood cells old dead blood cells and other stagnated fluids, bringing that more to the surface to be broken up, and that stimulates the body to bring fresh blood, fresh lymphatic fluids to help repair and regenerate those tissues. There's also wet cupping, in which a droplet of blood is induced with a small lancet, maybe a small blade, and then a cup is placed over that to draw even more blood out. This has a lot of potential benefits, but again, this must always be done by a trained and licensed professional because there definitely are cautions and contraindications. So cupping can also take many forms. There is the glass cupping, which fire cupping can be done with. Fire underneath creates the suction. Cups can be stationary or can slide. The pneumatic cups use the pump, and that can give a little bit greater sense of control sometimes over the amount of suction. It can also serve as a guide for sliding the cup. And then I've also been enjoying working with these newer silicone cups. They're a little more flexible. They come in different sizes for different body areas. I wanted to show an example of how the silicone cups are good for self-care at home. With just pressing this in, it's easy to create a suction. And I'm going to squeeze it just a little, or you can, if you have a narrower area, you can squeeze to a little bit different shape. But I just want to slowly pull this through the hand up here around the joints and create this feeling. The feeling of cupping has been described by some people as a reverse massage, and instead of the tissue being pressed in, it's actually being pulled outward. So it's creating some more space inside. It's a different way of moving. I hope this helps shed a little light on some options to consider for improving clinical outcomes of autoimmune disease. In the video description, you'll find some links to more resources for further information and finding a practitioner.